and tell me when to go ahead and get started.
One quick note. You don't have to say, let's wait to make sure we're live. I would just say, go on with your show. Cause I mean, it's been pretty reliable recently.
Okay. So just start whenever he says start. I'm good to go. Okay. Well, thank you guys for joining us today. Welcome to the LinkedIn Live Show Talent Tuesday, live with Leah. I have a very special guest today, Miss Carrie Weaver, who is a nurse in Fredericksburg, Texas, and has been in nursing for many years. And today she's here to share with us some of her insights on hospice care, hiring for hospice care, and then also the importance of mental health for those who work in that very niche type of medical care. So thank you so much, Carrie, for joining me today. I really appreciate you taking the time.
Well, thank you for inviting me.
Yeah, I'm so happy. So, Carrie, if you wanted to take a couple of minutes and just kind of introduce yourself, I think you could probably do a much better job than myself and kind of give the audience a little bit of background about how you got into nursing, what you do now, and a little bit more about you as a person.
So I have been a nurse for 21 years now, and followed in my mother's footsteps. Knew at the age of 6 I was going to be a nurse, and wore her white hat and white dress on every Halloween. And a little bit more about.
Oops. Go ahead. It was just a playback thing.
Yeah, you're good.
Sorry.
So then I started out and I was a med-surg nurse for many years. I've done recovery room nursing. I've done newborn, OR, ER, ICU, probably everything except for, I don't really like trauma that well. But, and I was teaching as well at Shriner in Crystal. And so I have med-surg background, mental health, mental illness background as an educator. And I've been doing hospice specifically since 2011. And then it was also part of my med-surg floor was palliative care. So really I've been doing death and dying for 21 years.
Wow. So, and actually I wanted you to also, for those that are watching today that are more on the HR practitioner side, they deal a lot more with hiring and HR management. They might not know what hospice care or palliative care is. And if you could kind of just give a brief overview of that specific type of healthcare.
Sure. So there's two entities, hospice, and then there's palliative care. All hospice includes palliative care, but not all palliative care includes hospice.
Okay.
And so there are hospital palliative care where it's extreme end of life, where they're not going to leave the hospital. But there's also community-based palliative care where people have diseases and palliative care helps keep them out of the hospital so much. It helps with symptom management, pain management, social issues. And it's also less scary when you say palliative care than hospice. Yes. Hospice is that you have a terminal prognosis. You do not want aggressive treatment, and you just want to live your life and have good quality. And so to come onto hospice, you do have to meet certain requirements that Medicare says. And that includes not getting aggressive treatment. They're not homebound. They don't have to be homebound like home health patients.
Okay.
And so when you're on hospice nurses and your team are your 911. And so it's actually a very critical, you have to have a lot of critical thinking skills to take care of your people at home.
Yeah. And I think that, I think I've always equated hospice with like the home health care, like, death and dying in your own home, surrounded by medical professionals. But I don't think I ever understood fully that the relationship between palliative care, in a hospital setting, and hospice, like the differentiation. So thank you so much for sharing that with us. I think that that's very important before we start. So you have worked in this space for 21 years. And you've taught, you did vocational nurse education at a university, and you did a lot in mental health and mental illness. And one of the things that we talked about, because it is Mental Health Awareness Month, is that for the nurses that you hire, you do a lot of check-ins. And I wanted to kind of get you can just explain to the audience today about how it's so much different from working maybe on a med surg floor or a trauma floor. It's a different level of intensity and critical care.
So for the mental health part of it, for my team, and it's not just my nurses, I include the entire team in all of this. I try to make them laugh at least every day, once a day.
Right.
Do our morning meetings in the morning to talk about report from the night before. I play lots of jokes on them. One included a vest that they had to wear that I stole the OSHA guidelines for construction workers. And I told them that it's healthcare workers, hospice specifically. And that was an April Fool's joke I did for them. I only made them do that for 2 days. But we do a lot of team building. I also I don't want them to see me as an authoritative person. So we go in rides together when there's nothing wrong. I'll show up at places when there's not an issue.
Right.
And so we have a very, very good working team that we laugh a lot. I feed them. I make a lot of food for them.
That makes a difference, I'm sure.
Yes. If somebody's having a bad day, somebody else will pick it up, and we just try to take care of each other and work as a team. I try not to, like I tell the girls, do not say my boss is coming to see you. I say my coworker.
Yeah, right. It's part of a team mentality. And I think that a lot of, what we were talking about when I first met you was that it's a lot about support, because this is such a mentally taxing type of position, that having that support and that environment where, like you said, you laugh and you joke, because it's such a serious job and it's such serious issues and you're having a lot of emotions every day, that you can be light and approachable and be supportive. And I think that that's really interesting, that you don't call yourself, like a supervisor or a boss, that you're like, no, I'm your coworker. I think that's pretty amazing.
Yeah. Because I do have to get very serious when it actually comes down to it. And they know the difference in, when you can play and when you can work. And my IT meetings, I do not run inefficient meetings. And I think that's good for employee mental health, because who
wants to be in a meeting
that isn't productive and takes too long.
Right.
So there are little twerks about me that they learn. Like, we're in IDT meeting, no talking until it's their turn,
Right. So, and I think, and I'll ask the audience, if you have any more questions about the difference between a hospital setting RN and a hospice or palliative care RN, please go ahead and put them in the comments, and I can make sure that we ask Carrie those. Because I want people to understand, because I'm going to ask Carrie some questions about the unique challenges or the differences in hiring a hospice nurse rather than some of the hiring she's done for other positions. So if you have any questions, please let me know. Rollis did ask, what would you say are the keys to holding an efficient meeting?
You start on time, you have your agenda, you keep to your agenda, and then you leave the end of the meeting open for forum time. And if you have to table things for another time, then you table them, and you don't, you stay on task.
Man, you are like, that was like automatic response. You start on time, you have an agenda, you stay on the agenda. I love it. That we could probably all learn something from that. We tend to like meander a lot. And I think that with a lot of our meetings have been virtual lately, and it's easier to get off topic. And it's really hard to pull people back in. But I'm sure that in your type of a setting, especially when the content is so serious, you might have a little bit of an upper hand there to be like, all right, time to have this meeting. We need to get this done. So, okay, well, let's move on then. And I wanted to talk to you about, your hiring practices. And we talked a little bit yesterday about, your nurses have to be both really, really great, practical. They know all the nursing skills. They have to have great critical thinking skills, but they also have to be a specific type of person. They have to have that empathy. So tell me a little bit more about what you look for in a hospice nurse.
So first of all, hospice nurses have a lot of autonomy that a hospital nurse wouldn't. Okay. So I have to trust that those nurses and all of my staff are out there on their own. And so I have to trust that they're doing the right things. They're talking to the patients and their families and being very, very compassionate. The other thing is that you have to be very flexible because you cannot have a schedule. You make a schedule, it will get messed up. And so that I do have one nurse that she loves her schedule, but I'll throw her for a loop once in a while when we get an admission, or if somebody has a crisis and I'm like, I need you to go do this. Okay, I'm going. And it throws her off because she's very like OCD in her organizational skills. The other thing is that we do not have a second eyes or ears when we're out there assessing our patients. We're out there on our own. Okay. But what I tell my staff is you're never alone because they can FaceTime me. They can phone a friend is what I tell them. Call me, let's FaceTime. I'll show up there if you're having issues. But our doctors do not see these patients for the first 180 days. They are relying fully on the nurse's assessment in our team for how to take care of these people. And so, yes, there's a lot of trust that the entire team has to have. So when I'm hiring somebody, we have to trust each other. And if we don't trust each other, you pretty much don't get to work with us because
you don't get to work here. Right. No. If I can't trust you. Well, yeah, I mean, it makes complete sense. And that's got to be a hard thing to gauge, like in an interview. And I know that you said you don't use personality type assessments in the interview phase, but you do them as team building to learn more. But I thought it was really interesting because you don't have a very big turnover rate. You tend to hire people and keep them for a long time. What are some of the tips that you could give to other people in the hospice space about your hiring, your retention and engagement of your employees?
So the hiring process, I don't do it on my own. I bring in the entire team. The entire team makes the decision because I do not have a good picker because it is very hard in an interview to gauge that. Mm-hmm. So I use the team, and then to keep them, they know up front what's expected of them, but we're also allowed to make mistakes. We are allowed to have a bad day. We are allowed to just come in and throw a fit and not, have that be a ding on you. And so we I forgot what the second part is that you asked, but I had a really good answer for it.
It's okay. So I was asking about how you keep the retention and the engagement, because you talked about the hiring, but how you're able to keep your same team, because there is, in healthcare, there is a pretty high turnover rate. People tend to move.
Yeah. And that was the other thing. They're allowed to have a voice. And they are allowed to be creative and innovative. And I tell them, I do not want to be the smartest person in this room. And so if you've got ideas, let's see if they work. If they don't work, we'll change our ideas. And so they make a joke about me. They'll be like, these are the rules today, but tomorrow Carrie's going to change them, because I'm like, well, it doesn't work that way. So
Right.
I have to change it up, because I don't like to work hard. I want to work smart.
Right. No, I think that that's probably a really good tip for any leader, is that, you know, you have to be able to be flexible and allow innovation to happen. And if things aren't working a certain way, your team is probably one of the best sources of information and resources to help you change the way that you do something. So that makes a lot of sense. What I wanted to move to next, and so since we're doing a little bit of a shorter show today, I really wanted to talk about mental health and mental illness. You know, you used to teach other nurses about, or nursing students, right? About mental health and mental illness, and about how to handle that from a nursing perspective, and then handle that in your own life. So I wanted you to talk about kind of, but besides, you know, like being an open boss and being, or colleague, I should say, what you guys do to really help your hospice nurses deal with the taxing part of the job, the very the mental heaviness of the death and dying.
So I'm very big on education, and I also rely on my social worker and my chaplain, who are both counselors.
Right.
And they do a lot of the mental health things. If we notice that one of us lost a patient and we knew it was going to be a hard death, we'll put the team members on that person to be able to talk that through and provide that support in a non-threatening way. My social worker, my chaplain, and myself, we also encourage self-care. So when I notice mistakes are happening, I know they're not taking care of themselves at home. So I'll tell them to go take the day off, and we'll pick up their work, and they need to go do that. Now, we also do things together as a team. And so we have a PRN nurse that comes and takes call for us once a weekend, or once a month on a weekend. And we'll do like some kind of retreat kind of thing, and no work related at all, and just decompress. And then I also make sure they're not taking too many call days in a row.
Yeah, I'm sure that's probably very important, is that they're not overworked. I thought it was really interesting that your social worker and your chaplain you said that they're both licensed therapists?
My social worker is a licensed clinical social worker. And she can do therapy, like counseling and that kind of thing. And then my chaplain is a LPC. And so both of them actually have their own practices for counseling.
And so they're in your organization usually to be available to the person you're taking care of and the family, but are those individuals also available to your internal staff?
That is absolutely yes. That is one of their roles, is if we have a hard death, we'll send the chaplain to that nurse. And so if you're having a hard time in your own life and it's not work related, we then call in the chaplain or the social worker to actually, take care of our staff.
Right. I mean, it's such a unique type of healthcare, and it's, you obviously know what you're getting, what you're doing. The nurse knows that it's not like, we're not here to save this individual. We're here to provide comfortable, safe care for the end of their life. So they come in with knowing that it's going to be heavy. And then, but there's things that happen that are unexpected. You grow those attachments, there's a lot of hard things at the end of people's lives that you're dealing with. And for somebody to stay in that role, for as long as you have to stay in this type of care for 21 years, I mean, I just think it's incredible. But that you have such a good retention rate, I think certainly speaks to the way that you manage the process. You manage your employees and your colleagues, and then you're providing them, safe and reliable mental health services. I think that that's just incredibly so important. So thank you for all of your work on that. And I think that you said that you love the education piece. Do you have your employees do any continuing education specifically for mental health?
Yes. So we use Texas, New Mexico hospice organization, and there is a most amazing speaker that they have certain like 12 little webinars just for nurses, and they have specific ones for the chaplain, social worker. Then they have a general one as well. And in those, there's a chaplain in that talks about all the taking care of yourself. And she even does an education piece on service recovery. And she says, tell your families and your patients, when I mess up, don't say if I mess up, because we will mess up. We are human and we will make mistakes. And you say, when I mess up, please let me know so that I can fix that. Because so we get a lot of words to say from these webinars that Texas, New Mexico has, the members they can use them as their CEUs, and there's mental health built into that.
That's wonderful. So for anybody that's watching, that's in the HR space and they want to learn more or find some resources about mental health care or hospice care or palliative care, do you have any resources that you would point them to, whether it's like the professional organization you were talking about, books, podcasts, speakers? I think that you probably have a wealth of information.
Yes. So we have the NHPCO, National Hospice Palliative Care Organization. That's an excellent resource. Texas, New Mexico is huge on education. And so that's our number one resource. And there's so many speakers out there. And again, that chaplain that's at Texas, New Mexico, her name is Carla Cheatham, and she's amazing speaker and keeps you engaged, and it's not monotone, and she is funny.
Well, that's important, right? That's important to be able to pay attention. So I wanted to end our talk today on a little bit of a lighter note. I wanted to ask you like two questions more about you. So I wanted to know, this past year has been tough for everyone. And, but I wanted to know, like, what big win did you celebrate this year, either personally or professionally? Was there anything that was just an absolute highlight for you?
Well, I think as a team, our company, like, we started following COVID positive patients in nursing, in specific nursing facilities that we're a sister company with. And so the minute they were COVID positive, we would pick them up on palliative care services, and I could symptom manage them. We did lose a lot, but of people due to COVID this year, just in general. But we've also brought like a lot of people out of it. And something that our team is just, when we have somebody that's actively dying, we step up our visits, and they'll all of a sudden get better for like weeks or months instead of passing away in the couple days that we anticipated. And so those are wins for us, because we're like,
I can't even imagine
this. And it's good quality, and they're able to die good and live very well and have a very good quality while they are living. And so I think for our team, and just for us in general, because that does affect, our personal, how we feel too, is once we get these guys, a lot of times they'll live a better quality of life. And
That's
actually,
amazing.
yeah, we get excited about
I'm
that.
so glad that you shared that, because I know a lot of people in the healthcare industry that have had a really tough year and they've lost a lot of people. But for you and your group that or your colleagues that are so used to losing people, to be able to be part of a solution for somebody and help them basically regain their autonomy and come back to life, basically.
Yes.
How wonderful. I'm sure that
Yes.
that was wonderful for your team to be a part of that. So my last question for you is, you mentioned that you encourage people to take time off when they need it, because that really, like, detaching from the situation, lowering the stress, taking time off and being away from the workplace. So if you could go on any type of vacation, expense is not an issue, COVID's not an issue, just pretend, where would you go for your vacation?
Me, the
Yes.
beaches of Maine. They're beautiful.
Beaches of Maine.
I do not like this heat. I love the beach, but I do not like the cold or the humid part of the Texas summer beaches.
Yeah.
I'll go to Texas beaches in the winter, but the Maine beaches are amazing, and it is crisp and you still get your tan. It is peaceful.
That is an absolute first for me. I ask this question a lot because I love to travel and I love to find out, what other people enjoy in traveling. And that is an absolute first. The beaches of Maine. So my husband and I have talked about going to Maine just to eat lobster and see the beautiful fall colors. So maybe we'll go in summertime and go to the beach. That's a great idea.
Now the water will be anywhere between 40 and 60 degrees. At 40 degrees, it will not go away. At 60, you'll get used to it.
Well, that's a really awesome. I'm so happy I asked you that question. So thank you so much for joining me today. And if there's anybody out there that's watching that wants to know more about the type of care that you provide, or your company, or learn from you since you've been in this space for so long, what's the best way for them to contact you?
I do emails very well.
Okay. Better than LinkedIn, you think?
Spam. Oh yes, LinkedIn is good too.
Okay.
So LinkedIn, and I'm working on updating my profile. I did have to change my picture recently. I realized it was maybe 20 years old and I don't look like that anymore. So I thought I don't want to.
That's hilarious. Well, no.
Surprise anybody.
Right. Wait, I wasn't expecting you.
Yeah.
That's so funny. Well, thank you so much, Carrie. I've really enjoyed talking to you today. And I'm just so impressed by the work that you do and how grounded you are. You handle so much stress and, so many really difficult emotions, and it seems like you handle it very well. So thank you.
You're welcome.
So much for coming on the show today.
Yes. And it also takes you have to have a good boss as a leader too. So, and that's something that I'm able to do this because my boss is an excellent leader.
Oh, that's so awesome.
So that's important.
Oh, well, thank you so much for sharing your time with me today. And for anybody watching, please go ahead and request Carrie as a connection on LinkedIn, and reach out to her directly on LinkedIn if you have any questions. Have a wonderful rest of the week. I will see you guys next Tuesday. Thanks so much. So Carrie, we just stay on for about a minute and then Jonathan will take it offline. That went so incredibly fast. You did great though. I think that you shared a lot of really great information. I saw that there was a lot of people that came in at